How to use an asthma action plan for adult asthma. If you or someone you know has asthma, you might be wondering how to manage it effectively. An asthma action plan can be your best friend in this journey. This personalized guide is created with your healthcare provider to help you navigate your asthma management. It lays out daily treatments, how to spot worsening symptoms, and what to do in emergencies. The plan is typically divided into 3 zones based on your symptoms or peak flow measurements. First, we have the green zone, which means your asthma is under control. You should have no symptoms or very few, and your lung function is at or above 80% of your personal best. In this zone, continue taking your daily long-term control medications as prescribed. Next is the yellow zone, which indicates caution. Here, your asthma symptoms may be worsening. You might notice increased coughing, wheezing, shortness of breath, or chest tightness. Your peak flow readings may drop below 80% of your best. In this zone, it is important to follow your plan's instructions to adjust your quick relief medication and possibly increase your controller medications. This is a signal to slow down and monitor your symptoms closely. Finally, we reach the red zone, which is a medical emergency. In this zone, symptoms are severe. You may have difficulty breathing, struggle to speak full sentences, or have a peak flow below 50% of your best. Immediate action is required, including taking prescribed emergency medications and seeking urgent medical care. To use your asthma action plan effectively, keep it accessible at all times. This could be a physical copy you carry or a photo on your phone. Identify your personal asthma triggers, which could include allergens, irritants, exercise, or illness, and take steps to avoid them. Follow the medication instructions carefully. This includes knowing the names, doses, and timing of both your controller and reliever inhalers or nebulizer treatments. If recommended, use a peak flow meter daily to measure your lung function and catch changes early. Regularly monitor your symptoms and compare them to the zones in your plan. This will help you decide which actions to take. It is also important to review and update your plan regularly with your healthcare provider, especially if your asthma changes or after any exacerbation. Know your emergency contacts and when to seek urgent care as outlined in your plan. For adults with asthma that started later in life, having a clear, easy-to-follow plan is especially important. Symptoms can vary, and other health conditions may complicate management. Using an asthma action plan consistently helps maintain control, prevent flare-ups, and guides you through adjustments during illness or increased exposure to triggers. This step-by-step tool is essential for adults with asthma to recognize their condition's status, manage daily treatment, and respond promptly to worsening symptoms.